So after a disaster or a traumatic incident, as we're trying to reestablish a sense of normalcy, and that can mean things like returning home, returning to work, getting back into normal routines, that can still be a high risk time for folks. Um, as you're grappling with the reality and the severity of what you've lost or potentially have lost during a disaster, it can really hit you. And so it's important during those times to make sure that you're watching your physical health, you're eating well, you're getting enough sleep, you're watching for harmful patterns of coping like substance use, and then making sure that you're reaching out to the people around you and that you have a good support network as you navigate that process. So for most people going through a traumatic event or a disaster, the vast majority, it's normal to have symptoms of distress, which can be things like feeling anxious or muscle tension or difficulty sleeping. The challenge becomes when those symptoms are prolonged. Sometimes those symptoms don't appear for weeks or months after the event has happened. If you start noticing things like changes in your mood, feelings of hopelessness, helplessness, difficulty functioning, that's when the stress is maybe beyond the scope of what would be expected, or maybe would benefit from some sort of assessment or intervention. If there are things that help you to relax, those things that have worked for you in the past will probably continue to work for you. As the severity of a trauma or a disaster increases, sometimes our resources can become overwhelmed. And the more that we have supportive relationships and people around us through that process and through that recovery process, the better we tend to do. Trying to recognize the things that are under our control and influence and manage those things while releasing the things that are beyond our control or influence is also important. We can spend a lot of our energy trying to change things that we can't, and that can just worsen the stress that we're under.